Okay, start now.
Okay. Hello, I'm Mariam, one of the ST5s in the department. May I know your name, please?
Yeah, I am James. I am the Steven.
Okay. Hello, James. How are you liking it here? I hope all are supportive, and if any concerns, I'm happy to help you.
Yeah, everybody is very supportive. No specific concern, but actually, I had come across this breech delivery and I wanted to know
Okay.
about it.
Okay. I really like your enthusiasm, James. It will definitely help you in the long run. Have you read anything about the breach?
I have read the guideline.
Mhm. Okay. So let me tell you what I'll be covering today. I will be telling you about the conducting. Is that okay?
Okay.
Okay. I will also be giving you some reading material and video links in the end of the session for you to go through them. How does that sound?
Yeah.
Okay. So first of all, we have to see that what is the gestation of the patient. Usually, a primary breech is an indication for elective cesarean section. And we also have to see that the weight of the baby should be between 2.5 to 3.8 kg to deliver vaginally. Also, the neck should not be hyperextended as the aftercoming head of the breech can become a matter. Then the different
Okay.
types of breech that are there is one is a complete breech, frank
Mm.
breech, and footling. So
Okay.
now in complete breech, it is when the hip and the knees both are extended. Okay. And the frank breech is when only the hips of the baby are flexed and the knees are extended. Both
Hmm.
of these can be delivered by vaginal delivery. Okay.
Hmm.
And footling is the third type that is usually a contraindication for the breech delivery, as there is a very high chance of cord prolapse to occur in this situation.
Okay. So
Now,
we
yeah,
will
can
not
you tell me
conduct.
what? Sorry, I didn't get you.
Yeah, we will not conduct breech delivery in footling presentation.
No, unless and until the patient comes in advanced labor and then there is no other option, we can consider, but it is usually a contraindication. Now, can you tell me the fetal weight for which you can try vaginal breech delivery?
Yeah, you said something about 1800 to 34 kg, something like that.
Okay, you are a fast learner, I must say, James. Now, we also have to see that the other requirements that is necessary for a breech vaginal delivery is that there is adequate analgesia given to the patient. Then
Hmm.
there are no other contraindications, such as the pelvis is not
So,
contracting.
okay, so can epidural be offered to this patient?
Yes, the patient can be offered epidural.
Hmm.
Okay. And we have to see that there is no contracted pelvis, there is no placenta previa, as in the placenta is not covering the cervix, or the fetus is not compromised, that is, there is no fetal distress occurring. And we have to make sure that during the whole time, the neonatologist should also be available. And we have to make sure that we are delivering the patient in a facility where emergency section will be always available. Are you with me?
Yes, yes, I'm with you.
Now, if we see that if the patient comes in early labor, we should always try and get a sonography or a USG done to check for the position of the fetal neck. Because if it is hyperextended, then it becomes difficult for us to deliver. Now, how we breech extraction. Now, in spontaneous vaginal delivery, we have to make sure the bladder is empty. The patient is in the dorsal or semi recumbent position, and we allow the breech to descend on its own. And once the breech is visible, then we tell the mother to push. Are you understanding me?
Yeah.
Okay. We wait till the baby delivers till the umbilicus, and then the angles of the scapula are visible. And we will allow the baby to spontaneously come down till we see the hairline or the nape of the neck. We also have to make sure that the back is always facing us, which is sacroanterior. And if the back is turning posteriorly, we have to gently rotate so that the back remains anterior only.
Okay.
Now, can you tell me the three different types we can deliver a breech?
Three different?
Types we can deliver a breech.
Yeah, there are three types of breech. That is footling, complete, and frankie, what you said.
Okay, that's nice. You're learning very fast. That's good. Now, in once the nape of the neck is come, and if sometimes the hands are stuck inside, we call it the nuchal hands. That is, the hand is extended. If the hand has not come down, then we have maneuvers to remove the hand. We either what we do is we gently hook the elbow and flex the hands and deliver them one by one, or what we can do is use the Lovset's maneuver where we rotate the baby 180 degrees, making sure that the back is sacroanterior and the posterior shoulder comes behind the pubic symphysis. Okay? And then we can gently remove the hand by flexing the elbow. And then
Okay.
again, we rotate the baby and bring the anterior shoulder behind the pubic symphysis and do the same putting much traction. We have to gently do this. Now,
Okay.
now, once the hands are off, we have the head. Now, there are three methods to remove the after coming head of the baby. One is the Mariso Smelly wheat method. Then there's a Burns Marshall. And if at all needed, there is assisted breech where we do it with the help of a forceps. The most used is the Mariso Smelly wheat method, where what we do is we hold the baby, that is the baby should lie on the non-dominant hand, the chest and the trunk, and we make sure that the fingers, that is the index finger and the middle finger, lies on the malar prominence of the baby's face inside.
Yeah. Okay.
The dominant hand, which is the right, whichever the dominant hand is put on the back of the baby's shoulders, and by when we pull the baby with the help of gentle traction. Okay. Hello.
Ah, yes, I got it.
Then there is also another Burns Marshall. It is usually avoided because it can cause hyperextension of the neck, and it is not used now very often. What we do is we let the baby hang from the neck, and then we hold both the feet, and then we flex the baby towards the mother's abdomen so that the chin can come out and we can deliver the baby's head.
Okay.
Lastly, we also have the option of assisted vaginal delivery, where the aftercoming head we can use the forceps. The commonly used ones is pipers because it is long and it helps in a smooth delivery of the head. If that is not available, we can also try the Keelan's forceps. And the applications is just as similar like how we use in a cephalic. And if at all an episiotomy is needed, if it was not given before, we have to make sure that after analyzing everything, we give an episiotomy. Okay.
Okay, got it.
Now, once the baby is delivered, we will hand it over to the neonatologist and we will debrief and document all of this. And before applying the forceps, we have to take a consent. And if it is in the emergency, we can take a verbal consent and then take a written consent later. If at all of these methods also don't work and we still the baby's head is stuck, we can give emergency incision such as Drussen's incision, which is an incision on the cervix. And then rarely we can do symphysotomy, which can be issue to the mother as well. And if at all the baby's heart rate is still there in the end, we can try for a cesarean section. But these are all last resorts. Okay.
Okay, okay.
You have any questions for me, John?
No,
Quick.
actually, yeah, I just wanted to know the means how this breech is getting means breech deliveries are getting conducted, and various maneuvers. So you said about Losset maneuver, you said about Von Marshall, Morris's maneuver. So yeah, I wanted all those things only.
Hmm?
Yeah.
Anything you want me to improve on so that I can help you?
No, your time is
Yes.
up. Okay.
So
Uh,
yes, ma'am.
yeah. End your task.
Okay, so I will also be providing you with reading material and videos, and we will be conducting a breach delivery. If any time there will be, I will be calling you so you can learn during that time.
Okay,
Is that
good
okay?
job. Yeah,
Thank you for your time.
yeah. Thank you. So, your own reflection about your task, then I can ask someone who can guide me where
Okay,
exact. Well done. Okay, you are having a very good knowledge about breach delivery.
so, ma'am. Uh, I think I was taking too many pauses, ma'am. That is what
No,
I
but
was
that
fumbling
pauses
a
is
lot.
no pauses are important because you need to give role player time to absorb the information, whatever information you were giving. Okay.
Okay, ma'am. Uh, I feel applied clinical knowledge, one, I can do more. I could have, if I would have spoken a little more, I could have even given, thought a little about external cephalic version. And I made a mistake in speaking about this complete breach. I said both hips and knees are extended, which I realized later. So there
Okay.
was,
No,
and
but
I didn't,
I, complete breach. Yeah. Hmm.
both is flat. And I didn't ask about patient more information gathering.
Yeah, you missed out on that. Very nice observation. Okay. Uh, Anybody can comment on her performance, whosoever was there. Manikam ma'am, would you like to comment?
Yes, ma'am. Ma'am, she has done well, ma'am. Overall, the performance is good. Few points to be added, ma'am.
Mhm.
First, it should be conducted in the presence of a well-trained
Yeah,
specialist midwife trained in the conducting breech
not
delivery at
midwife.
bedside.
Yeah, yeah, those are the prerequisite. We need to discuss that. A trained
Uh,
personnel who is skilled in conducting vaginal birth, breech birth.
yes, ma'am.
Skilled personnel, and it will not be midwife, it will be consultant most of the time, or the
Yes,
ST6, ST7. Okay.
yes, ma'am. And the informed consent from the patient is very important, ma'am.
Yes, very important.
And I mean, as continuous fetal monitoring will be, I
Yeah,
mean, better.
yeah,
It should be
yeah.
done. Important thing.
What is the
And if
role of epidural? Role of epidural, what do you think?
epidural is not favorable in breech vaginal delivery because
It
the
increases the chances of interventions.
Mm, yes,
Hmm.
ma'am. And
Hmm.
she said recumbent or lateral. That's better, ma'am. And
Yeah,
about the hacks of technique, she should have mentioned.
yeah.
And
The
and
knowledge part she is having very good, but when it comes to teaching, she couldn't
uh,
apply it well into the teaching task. That is
yes,
my observation, Dr. Mariam. Okay, whatever
ma'am.
feedback I will be giving, don't take it very, take it seriously, but
Yeah.
uh,
Mm,
this is a
Ma'am,
okay,
that's
ma'am.
critical
how I will
feedback.
learn it's needed, ma'am.
Yeah, it's a critical feedback. So you
Okay.
are having a very good knowledge when it comes to breach teaching. Okay, breach
Hmm.
maneuvers. You were very
Hmm.
good when I start tried to explain me all the maneuvers, but imparting it into the teaching task was missing out. Too much of
Hmm.
information will not
Hmm.
will not be a safe idea to go into the teaching task. In teaching, actually, you have to involve your trainee completely.
Okay, ma'am.
Hmm? Okay, so that was missing actually. Totally, you were continuously speaking, and you were asking me questions which was not related to teaching. Here, the questions were one question could have been sufficient. Okay, in the beginning when you asked. So, can you just enumerate what we have discussed up till now? Means, do not ask very specific information. He might not be knowing or he might not be knowing. So, what we have discussed up till now, can you just tell me? Something like that. So basically what we had learned, prerequisites. So what are the prerequisites? So two three questions, so very pinpoint information he might not be able to explain it to you. Okay,
Okay.
so one thing is that, then once you need to ask this, and then you need to explain the procedure properly, and lastly hands on, dear. Do not miss out. Okay, so while let's come up. Okay, I will show you on this mannequins. There will be always mannequin. Okay, and that's the reason even I have introduced props in my task. So always say, if it is for the patient, if it is not without the mannequin, but it will not happen. There will be always a mannequin where there will be a female pelvis and a vaginal a breech model. Okay, a baby's model with which is breech presentation. So at least ask him or allow him to perform at least one step, one single step. That is what a teaching basically. Not only telling, not only imparting your knowledge into his mind is not teaching. Teaching is
Okay, ma'am.
involving your role player into your consider in throughout the consultation. Okay, so that
Okay,
was
ma'am.
missing out. Okay, now you check the background knowledge about the resources. What with from where have you read? Okay, so what you have read, but
Mm.
did you ask so how the baby was? I said that I had seen the baby's delivery yesterday. So have you seen means what was there any complication how the baby was delivered? So what do you know about breech vaginal deliveries? That is another checking background knowledge. Hmm?
Okay, ma'am.
Okay, so that is another checking background knowledge, very important, which comes onto information gathering, communication with colleague domain also, because we are here basically communicating with the colleague. That one thing. Then the task. Uh, it was mentioned that you have to explain about the breech vaginal breech delivery. Okay, stepwise
Okay.
manner undertake vaginal breech delivery. But you need to ask whether there are any other things which you are interested to know, because sometimes he may be having some questions. Hmm? So any
Ma'am.
particular something like concerns what we are asking in the role player task concerns na. So here in
Mm.
teaching module we are in the beginning only we are going to ask what are your expectations from today's teaching session.
Okay, ma'am.
Okay, so do not miss out on this question, because it is something like asking a concerns in a role player task. So the role player is a non-medical person, he might not be having the means he will be having a different concerns. But here I am a medical guy. I will come up in teaching task with certain expectations. Okay, so I want to know this. I want to know this. I want to know this. Okay, so something like that I would like to. So always ask what are your
Okay.
expectations, and that will be into the role players that the script of the trainee also. Okay, something like that. Then prerequisite, you missed out on two prerequisite. One is skilled personnel and another one is written protocol. Okay, then the procedures were very nicely explained by you, so that knowledge part you had imparted very nicely, dear, but the patient safety point you had missed out. Hmm? So let's go through the answer key. So introduction was good. Rapport building. You
Yes,
tried to
ma'am.
ruling out bullying. Aim of the teaching. Any particular reason for this teaching session? Okay. Checking background knowledge. It is checking background knowledge basically about the breach delivery and breach knowledge. What means did you read this rather than reading it will be actually practical session. So I will ask, have you seen, have you conducted, have you assisted, whether there was any difficulties, all those things. So setting agenda basically here what you wanted to know from today's consultation, and then we will be discussing the not consultation, it is a session, teaching session. So what are your expectation from today's teaching session, and then
Okay.
in under that heading, okay, so I will divide here only. So what we can do now
Mm.
today, I will be means we will be discussing the prerequisite, how the vaginal breech deliveries are getting conducted, certain maneuvers to deliver it, and then we'll be sharing with you the resources. And at the end
Yes,
you
ma'am.
can just give me some feedback about the how did you like my teaching. Okay, okay, so
Okay, ma'am.
now here is one of the important thing. Okay, if sometimes
Okay.
there might be a patients which who were involved in this scenario, sometimes it might be a mannequin. If it is a mannequin you do not need to go into the details, but if it is a patients, then please mention, because here what we are getting marked on this communication with patient and families domain. Okay, in this task the domain is
Yes,
there.
ma'am.
So you have to bring your patient somewhere or the somehow. So the
Okay.
first thing is introducing. Whenever you are conducting a breech delivery, please ensure that you will introduce yourself to a patient and the companion. Okay, whosoever companion. if that is the communication with patient domain, one point is addressed. Then you can hear, actually, as you rightly mentioned, that you should have mentioned something about, so there are options of breech mode of delivery when it comes to breech presentation. First is extended cephalic version, breech deliveries, and LSS. So indicated is LSS, no. The recommendation for it, not only in primary breech, the recommended mode of delivery in breech presentation is lower segment cesarean section. It is a recommendation.
According to everybody. Yes, ma'am.
Okay, so it is recommendation. Now, what I had mentioned here, see, how you feel, have you seen breech delivery before conducted, any experience with ECV, something like that. What are your expectation from today's teaching session? Check background knowledge and answer those points only asked. These slides contain elaborate information. So whatever information they had asked, basically be focused. If it is steps of breech deliveries, then we will go to the steps. Okay. So this is extra slide what I had mentioned. Okay. So the baby is lying bottom first, or a sacral presentation, means the presentation will be, what will be the presentation? It will be the breech and the presenting part, something like that. Sacrum.
Yes, ma'am.
Yeah. So it will be sacrum.
Denominator.
Yes.
Denominator.
Yeah. Denominator will be sacrum. Yeah. Denominator will be sacrum. Then the incidences are 3 to 4% in breech presentation, in patients. Okay. In term pregnancies, it will be 3 to 4% for 4%. Uh, Type of breech. So type of breech will be extended breech, flexed breech, footling breech. You do not need to go into the detail. It is just a slide which, just to enter in, before entering into the session, you just need to say something about the breech. That's the reason I have given this information. Now this is very important slide. Okay, the prerequisition of breech delivery, because they had asked also what are the principles of conducting vaginal breech delivery. Unless and until the prerequisites of vaginal breech deliveries are not completed, you cannot offer vaginal breech delivery. What are those prerequisites of vaginal breech delivery? There should be written protocols about vaginal breech delivery, up to what extent you are going to give a trial, when you are going to intervene, when you are going to offer cesarean section. So those are the, you do not need to go into that detail, but there should be written protocols. How, if somebody is insisting on vaginal breech delivery, so what are the protocols? So the proper written protocols should be there. A skilled consultant or skilled personnel needs to be there to conduct this vaginal breech delivery. Information to your consultant is important, and neonatologist is important, because those are the people who ultimately needs to be involved in the care of the patient. Selection of appropriate patient by ultrasonography. So what is the selection of patient, appropriate points? Here one is footling presentation is totally contraindication of what you had mentioned rightly. SGAs, all babies who are having SGA, that is less than 10%, they are the compromised baby, so we should avoid vaginal
Okay.
breech babies. EBW more than 3.8 gram, or 3800 gram, or 3.8 kilogram. Hyperextended neck, which you had mentioned, and other fetal compromise. Okay. Then informed consent. Informed consent is very important from the patient. In this case, I will say that the written consent will be documented in her case details. No induction of labor, no oxytocin for slow progress. Epidural increases the chances of intervention, so that we need to be, don't worry, don't write it down. This will be available on the YouTube. Okay. So epidural increases the intervention, so it should be discussed with the patient. Alternative pain relief will be discussed with the patient. Continuous fetal heart rate monitoring. Pediatrician or neonatologist we had mentioned previously, only at the time of birth. Yes, you mentioned that the access to cesarean section will be there, but whenever the consultant led care unit comes, it is always associated with your access to cesarean section. Okay. Paired cord blood gases to be done once the baby will be delivered. Now it will be, now the steps of the vaginal breech, vaginal breech birth. Dorsal position, you mentioned. Bladder empty, you mentioned. Now, whenever we are conducting any maneuver during the labor, whether it is shoulder dystocia maneuver, whether it is breech delivery, even normal delivery, always make sure that you will be maintaining the patient's dignity. Adequate exposure is only important. Okay, so that is very important. So adequate exposure and maintain patient's dignity. Consider episiotomy as we need manipulation, and selective, the role of selective episiotomy, although they are saying the role of selective episiotomy is important in cases of breach, but we have to consider, means we will recommend, or we can say that consider episiotomy as we have to do certain maneuvers. We may have to end up in doing maneuvers. Active pushing should be delayed, as you rightly mentioned, until breech is descending to the introitus. Watchful expectancy or hands off technique. Very important. Okay. Till delivery of breech up to the umbilicus. If there are any delay or compromise of the fetus, then only you are going to give the traction. Encouragement of maternal effort should not start until the breech is visible. Till that time, we are not going to. Maternal effort should expel the breech spontaneously up to the level of umbilicus without traction, and breech should be in sacro-anterior position. If the back starts to rotate posteriorly, gentle traction should be given so that the back will be rotated anteriorly by giving a gentle pressure on both the thighs, okay, or buttocks. Sorry, not thighs, it is on the buttocks with the help of a towel. Hmm? If fetal legs are extended, by that time, if the fetal legs are extended, legs may be delivered by applying pressure with two fingers on popliteal fossa to flex the legs at the knee joint. Adequate descent of breech is in passive stage is a prerequisite for encouragement of active second stage of labor. This is an additional point which I had mentioned here. Once the buttocks have passed the perineum, significant cord compression may occur. So ensure that your cord should not compress, should be kept out of the, means you have to ensure that the cord should not get compromised. Avoid any tactile stimulation, because a tactile stimulation may result in hyperextension of the head and arms, making delivery difficult. Hence use, many a times we may use a warm structure, okay, warm gauze, weight gauze, or means warm gauze around the baby. Care must be taken to do all maneuvers to avoid fetal trauma. Fetus should be grasped around the pelvic girdle, not soft tissue, and the neck should never be hyperextended. So avoid, it is very, means the chances of injury into the fetal vaginal breech deliveries are very common. So always ensure that there should be minimum trauma to the baby while conducting vaginal breech delivery. Easiest part is to delivery of the baby's buttock, shoulder, arms, trunk, but the difficult part is after coming head. Okay, once the inferior angle of scapula is visible, the arms can be hooked down by inserting finger in the elbow and flexing the arm across the chest. This is the easiest method to deliver the shoulder and arms. If there will be any nuchal arm or extended arm, then low set maneuver. Low set maneuver, very nicely you had explained me. Here is a diagram where it has been shown that initially 180-degree, you can say that clockwise manner, then anti-clockwise manner. So initially the posterior arm gets dislodged and delivered through pubic symphysis, and opposite direction again you are going to do 180-degree rotation, where another anterior arm will also be rotated, something like that, which we have you have mentioned very nicely. So low set maneuver, they will ask about low set maneuver, so please have a good knowledge about low set maneuver. Delivery of the after coming head, three methods. One is Burn Marshall, then Morris's Mill weight maneuver, and the third one is the forceps. Burn Marshall maneuver is nowadays not been done. Morris Mill weight maneuver, yes, non-dominant and dominant hand. We are having two hands. The non-dominant hand, we will be placing the baby on our anterior aspect of the hand, non-dominant hand, and the two fingers on the malar prominences, as you rightly mentioned, not to be introduced into the mouth because there is a chances of injury. Okay, very important thing. Then the dominant hand, three finger to the index finger and the uh, third finger, okay, the fourth finger, or the not ring finger will be on the shoulders, and the middle finger will be on the occiput, so that it will continuously given the force on the occiput to flex the neck. Simultaneously your assistants will be giving suprapubic pressure, which will be keeping baby's neck into the flexion position. And the flexion will be also exaggerated by putting a pressure on the malar prominences. So this way your Morris Mealy weight maneuver will be completed, that the baby's head will be delivered by this maneuver. Okay, so that means exaggerated flexion of the head. Burn Marshall, let the baby hang on its own, hold both the legs and rotate, okay, and make a complete rotation over the maternal abdomen. Okay, by this maneuver most of the time baby's neck is getting delivered. Okay, but this maneuver is not advisable due to concern over extension of the neck, over extension of the fetal neck, so it is not being done nowadays. So you just need to have a knowledge how the maneuver is getting done, no need to explain. Okay, so no, means you just need to have a knowledge, no need to go into the depth. Then application of forceps. So when it is indicated, when the baby will not be delivered by MSV maneuver, then only it is indicated how you can ask your assistant to hold the baby upward. Okay, lift the baby upward. Then phantom application is very important. Lubricate the forceps. The forceps type is Piper's, or you can use keel and forceps, because they are not having a curve, axial curve. Okay, axial curve is not there, so it is easier to apply this as, and the application will be similar to cephalic application, what we are using, what we are doing into a cephalic position. Okay, ensure this will be done by the experts, because this is again a very expert procedure needs to be done. And here we are going to consider episiotomy if we have not given previously. Very important safety point, adequate analgesia will be given to the patient and the baby's head will be delivered. Okay, simple method, you will be delivering the baby's method. Now the post procedure care will be, baby will be handed over to the neonatologist, clamp, cut, active management of third stage of labor will be offered to the patient. Perineal care and suturing of tear. After assessing the tears, we need to suture the tear. Documentation, debriefing neonatologist to assess the baby. Emergency surgical management of fetal head entrapment. Sometimes the fetus might get entrapped, and which includes cervical incision, like you mentioned, Deuce's incision. Um the way you mentioned about cesarean section and all those options, it I don't think they will be doing it. More destruct means, I will say here that more destructive procedure, if the head is not getting delivered with simple measures or with advanced measures, then more destructive measures needs to be done, and for that we have to call informed consultant. Hmm? Okay, we are not means in our clinical practice nowadays we are not seeing even symphysiostomy tomy also. So it is very important, whatever destructive measures you are going to say that it will be done by the consultant, we will be not doing. But yes, head entrapment is a real complication which is difficult, frightening to the consultant, means frightening to the team also. So Dushan's incision, that is the incision which will be made on the cervix at 2 o'clock or 10 o'clock to avoid lateral extension of incision. uh, this is the option what we can do. Okay,
Yes, ma'am.
and by the end, if you are having a mannequin, whatever maneuvers, one at least give your role player one mannequin to attend. Okay, that is what is important. Now coming to the domain wise scoring, understanding when to continue teaching, when to intervene, that is very important, and you need to know. When you started explaining me about the maneuver, you were continuously talking. So in the beginning you were checking my understanding twice thrice, but once you started explaining me the maneuvers, you continuously, because you know that you know this, you are having a good knowledge about this, so okay, I will impart this knowledge to your mind. No, this is not, you involve your role player here. Okay, Safety check. What safety check you need to do whenever you are going to perform the procedure, and what are the appropriate steps you are going to take safely. Something like what are the prerequisite episiotomic, CTG, not giving epidural, not starting or on oxytocin. All those things are safety checks which will be covered here. Avoid dangerous maneuver, including fundal pressure, excessive lateral or downward traction. Okay. Explain importance of documentation, ability to identify the risk factors. Senior or consultant needs to be involved. Demonstrate understanding of clinical governance or risk management issue. Any untoward complication will be notified to the risk management team. Suggest adequate training in the form of skill and drills. Yeah, that also we have to mention. Okay, so the means resources, see, skill drill trainings can also be arranged for the training. Highlight importance of adherence to the policies and procedure. Consent patient after explaining the her implications of vaginal breech delivery and proper case selection. Communication with colleague, understand the principle of adult learning, giving feedback, takes appropriate steps in increasing clinical and technical skills of the learner, ability to use appropriate language, non-verbal language to encourage learning, which you were able to encourage, inviting questions and encourage dialogue, show logical approach in building pre-existing skills of the learner, establish the learning needs, check pre-existing knowledge, use the resources provided, use a variety of teaching methods, example, illustration, model. Active involvement of the team trainee, promote team working, makes trainee demonstrate while talking whether the steps are allowed trainee to talk through while demonstrating. Finally, gives opportunity to trainee to independently talk through the demonstrate the whole scenario. So this is very important. Okay, that this last point is very important. Do not forget that. Information gathering. What here? So what is information gathering? You have to check the background knowledge what your trainee is knowing, that is information gathering. Outline the expectation of the trainee, what he wanted to know, that is information gathering. And this is basically regarding the breech delivery. So when you need to intervene, that is basically when after the delivery of the, from delivery up to the buttocks and up to the cord, the baby of the head should be delivered within 5 and 3 minutes respectively. Okay, so basically this is from the breech, then only you need to start on intervening. Applied clinical knowledge. Understand steps in task being undertaken, that is teaching. Understanding the learning objective outcome in relation to task being taught. Conduct and give feedback using work-based assessment tool. Knowledge principles of breech delivery. So basically, it is about this green top guideline about breech presentation. Okay. In this domain, whenever in structured discussion and especially in stimulated colleague task, if there is communication with patient and families, domain is there. So 2 3 points you just need to ensure: introduction and consent. Okay. So this 2 point at least you will say. So communication with patient and families has been completed, and debriefing the procedure after the procedure has been completed. So introduction to the self and duty and the task to the patient and partner. Explain roles of trainer, duty, nature of interaction with the patient. Informed consent from for the procedure. And once procedure has been completed, you can debrief about the procedure. Okay, so this is what our first task is. Anybody is having any question?
Ma'am, I will be able to complete in 10 minutes, ma'am, by
So that's the
telling.
reason. In the beginning only you have to ask what you wanted to know.
Okay, because here this task is elaborate, no, ma'am.
Very elaborated, very elaborated. So you
Okay.
have to ask in the beginning what exactly
Also,
you wanted to know, because you
okay.
cannot rush this task. You cannot rush
Hmm.
this task.
Okay, ma'am. So accordingly, they will say I want this and that.
This. So first teach that person those points, and
Okay,
then
ma'am.
only. So mostly it will be prerequisites and steps of vaginal breech delivery. If it will be simple, then this will be able to, you will able to do it. Sometimes they might ask you complications of vaginal breech, so you can say that. Well, yes, dear. Birth trauma, birth
The
asphyxia.
consent will be only during. Okay. Sorry, what? No, ma'am, sorry. I was just asking that the consent will be only during forceps delivery, no? Elsewise,
No, no,
consent.
no, no, no. It will be a vaginal breech delivery. See, vaginal breech delivery is something nowadays nobody is recommending. Why? Because there are the risk is more than the pros. The risk to the baby is very high. So that consent, basically you are going to take at least verbal consent, and document it into your case detail. Discuss pros
Okay.
and cons of the vaginal breech delivery and document it into your case detail. But I will say that consent, at least mention consent, whether it is verbal, whether it is written, but you need to take a consent from the patient about regarding vaginal breech delivery.
Okay,
Okay,
ma'am.
not only for forceps, it is vaginal breech delivery, and explain pros and cons of the procedure.
Okay, ma'am.
Any question anybody's having? It's actually a elaborate task. Means all these labor tasks are pretty elaborate because they might be asking. So what you can do, practice, 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 and make your sentences very small. Okay. Next task.